Hi, do you remember going on long car journeys as a child? My sister and I would sit in the back squabbling. Our parents would try and buy our silence with polo mints, and mostly it worked. Have you noticed how when you bite a polo it breaks in two places? This is what happens when a younger person falls backwards onto their bottom. The bottom spinal vertebra will then break into two pieces, like a polo. This can be pretty painful, and it can take at least a couple of months for the pain to ease. But the fracture does not actually repair. The front part slides forward, leaving the rear part behind and a gap in between them. This creates a step defect. Often the back pain will disappear and the patient can feel fine until something puts more strain on the area, like a hip or a knee problem for instance, or if there's a lack of muscle support, which often happens later on in life, often years after the injury. It mostly manifests as leg pain because there's some nerve entrapment where the broken bit slips forward. We'll often find that the knee reflex will diminish or that there's weakness of the leg when we test it. Lots of other things can cause nerve changes, so how do we know it's due to an old fracture? Remember the step defect I mentioned earlier? You can feel it when the patient's on their side. Okay, the lowest spinous process will stick out more. Remember the broken polo? This is what happens. It's unstable, and it can be tricky to get these conditions to settle down. Sometimes improving the hip or the knee will help. Increasing the core strength makes sense too. But unfortunately, some patients don't improve this way and need surgery to stabilise the segment. This isn't something that anyone rushes into. Remember, this fracture happens when we fall backwards. In another video, I'll discuss a different type of fracture and a different type of mint. Thanks for watching. Bye for now.